Vacations, traveling with advanced cancer. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years. I was at a party on the weekend and I was talking with some people about how traveling and vacations could actually be good for some people with advanced cancers. So I was reflecting on one of my first cases where this patient, this is probably over 15, 20 years ago now, who had an advanced cancer, colorectal, stage 4, the liver, the lungs were full of tumors, so many that you couldn't even count. But otherwise, uh, this person looked good. The performance status was pretty good. And so her and her partner, they just wanted to get away. She was in treatment, receiving chemotherapy every few weeks or so, and so she went to, I think it was Hawaii, and anyways, I knew that she was back because her lab results were starting to come into my office, and when I looked at them more closely, I was scratching my heads, looking, going, well, wow, like her liver numbers or liver function lab results all dropped. Her tumor marker dropped. In fact, I saw this little note that said checked because her oncologist saw the same values, probably was scratching her head and saying, wanted to confirm that the lab didn't make an error. So, anyways, when I see this patient, I said, "Did you see her lab results?" She was like, "Yeah." Like, I go, "Did you do any treatment there? Did you see some healer? Did you do some program?" And she goes, "Walter, all I did is I unplugged. I needed to get away." And so, and so I said, "Well, it sounds like maybe you should be living there." And she goes, "Yeah, I know. I wish I could." But anyways, it was like she did nature's chemotherapy. What happens with groups of people, obviously, when they're diagnosed, it's like a whirlwind of things going on. There's appointments all the time, there's tests done all the times, there's things that are happening, procedures, treatment, and which is obviously it's a load. And I've seen this actually phenomenon in several other patients where there's something about it when they leave and they travel to some place. It doesn't have to be far, it could even be locally, but unplugging that they've coincidentally they do better. They seem to respond better to treatment, and they look better. And so, and again, I know that there are potential risks with travel. Things could happen. And so you always have to kind of customize to every individual case in person. But in my practice, and perhaps I'm selecting a certain group and a certain demographic, but in my practice, I tend to have like open discussions on travel and vacationing, getting away, seeing family, loved ones, or just doing things for yourself, just to unplug and get away. And so I just want to kind of put this out there that when you have a diagnosis of an advanced cancer, and even if you're on treatment, it doesn't mean you can't do things and live your life or do things that you want to do. Because guess what happens when you do that? Your body feels lighter. Your immune system is most likely more robust, more happier. And the whole, mind body connection, psychoneuroimmunology, all of that stuff. So I just want to say that you could have permission to travel, to go and do things out there, even if it's short stints. Like we have patients who say they're getting treatment every 2 weeks and they're delaying their chemotherapy to 3 or immunotherapy to longer than that. And so I know there's obviously complexities, and not all cases, you could do this, and you have to, be careful. Like every one of our patients, like knock on wood, they've all made it back. But anyways, I just want people to know that traveling and vacationing could actually be a form of medicine as well. And so don't restrict yourself, and that have good discussions with your healthcare provider teams. But this could actually be good for you, could be like a form of side treatment. So something to think about when if that comes up for you.